This week, we're going over dental anesthetics. So, in the dental office, so the different types of topical, local, what they mean, what you need to watch out for. Certain patients can only have a certain type of epinephrine. We talk about all of that. And if you're a Dentalelle member in one of my board exam prep academy courses, we go through different topics every single week. But what I'm going to do for you here is kind of do a really good run through of what you need to know for the exam for dental anesthetics. Now, I do have a free guide for you. If you're interested in everything that I'm talking about in this video, feel free to go to the description of this video and then you will see the link where you can pick this up. But you can also take screenshots, you can take pictures on your cell phone, whatever you prefer. But it is kind of nice to have a free guide to kind of review and then you can practice your studying afterwards too. So, just kind of a run through here. So, topical versus local anesthetic. Let me just zoom in a little bit here. Oh, sorry, guys, wrong one. There we go. Topical versus local anesthetic. So, what's the difference? So, we all know topical is being the one that numbs the area before the needle goes in. So, topical is that gel on a Q-tip. There's even spray topical. There's different forms. There's different types, but that's typically the one that you would see in the dental office. Local anesthetic is the needle. So, what's the point of topical then? So, topical, we put that on the gum to help to numb the area for that needle prick. So, the client, the patient doesn't feel it as much. So, the topical is applied to the mucous membrane and it's just going to have the numbing effect, maybe a millimeter under that, but it's a very, very small area. It's not meant to be a full on anesthetic like a local that's actually stopping the nerve conduction. So you don't feel that pain when we're cutting into your tooth, right? So, what is topical? To summarize it, it just kind of goes before the local anesthetic. But there's other reasons why we would use topical. For example, as I had mentioned here for you, you could use it when you're putting on the rubber dam. That clamp has to go around the tooth, but sometimes it is on the gums a little bit, and that can be very uncomfortable. But if we apply topical first to that gum area, that can really help to alleviate any discomfort. Now, topical works right away, honestly, right away. It says here within a minute, but I find it does work right away. Whereas local anesthetic is different in the sense where it's going to take longer to work, sometimes even 5 minutes, but also sometimes up to 20 minutes, depending on the type of anesthetic that is being used. So there are differences here. Now, going over to number two, when would you use a topical anesthetic and when would you not? So I briefly talked about this already, but you would use it for any time where you were applying a local anesthetic because it just helps to numb the area, make the area less uncomfortable when we're pricking them with a needle. But you could also use it for teeth cleanings. I mentioned the rubber dam. If you're taking impressions or x rays, that might be helpful to reduce the gag reflex. Although personally, I haven't found it really worked for me when I tried this, but you can try. But it's not a good idea if you're applying topical to an ulcerated or damaged tissue. If the gum is really inflamed or there's a sore on the gum, applying topical isn't really a good idea because it's not going to work very well. For procedures needing pulpal anesthesia, they say you can apply the topical there, but it's not going to make much of a difference anyway because a pulpal local anesthetic can be a little bit more painful, but we've done this in the dental office anyway, where we just automatically apply the topical before the local, but that's just an example given here. Now, also with patients with known allergies to esters, if a patient is known to be allergic to topical anesthetic, then of course we wouldn't give it to them. Or they've mentioned they have allergies, but they don't really know what their allergy is to a different anesthetic or a certain type, we wouldn't give them local. But it's very rare to be, or sorry, topical. But it's very rare for somebody to be allergic to topical anesthetic. It's more common, not common, but it could happen if somebody's allergic to a certain type of local, but topical is very, very rare. Now, number three here. What are the most common local anesthetics? So now we're switching it up from talking about topical. Now we're talking about local. What are the most common ones? Lidocaine, I would say 100% is the most common. This is the one that I would always work with in a dental office, but there's also articaine, mepe- mep- mepevicaine, that's hard to say, prilocaine, and bupivacaine. So again, they're Pronunciations, we all kind of say them a little bit differently. But lidocaine, I'd say, is the most popular. We have the 2% and then 4%, 3%, 4%, 0.5%. So notice the different percentages here with the epinephrine. So this is important to know. Some are going to have epinephrine, some of them are not. For example, the mepivacaine is the plain one, where it's good for shorter procedures or patients who cannot tolerate epinephrine. Why would a patient not be able to tolerate epinephrine? Think about it. Maybe they have a certain heart condition, maybe there's an allergy, maybe there's many different things, but we'll talk about that a little bit later. But there are certain ones that are going to last the longest. So this is good to know as well. So typically, the ones that last the longest do have epinephrine in them because epinephrine in itself is meant to make the anesthetic last longer. And epinephrine is also a vasoconstrictor, stopping bleeding at the site. But don't worry, we talk more about that later too. So, moving on here, how vasoconstrictors like epinephrine affect local anesthetics. So, I briefly touched into this a little bit, but it's meant to basically stop bleeding at the site. And this works really, really well, especially for procedures where there might be a lot of bleeding. Think of a crown prep. Think of things where you're very close to the gum and there could be bleeding involved. If there's too much bleeding, we can't do our work properly. So typically what happens in a dental office, we're going to use a local anesthetic with epinephrine unless they have an allergy or a heart condition or we're not supposed to use it because it just makes us work easier, quicker, we do a better job. So epinephrine is the way to go. But what does this mean? So, epinephrine is a vasoconstrictor, which narrows the blood vessels in the area where that site is injected. So, this is important because it makes the anesthetic last longer, not just 5 minutes, but it lasts longer so we're able to do the work. But it also reduces the bleeding, which I talked about, and it slows systemic absorption, which is important. So, if less anesthetic is being absorbed into the stream, the risk of toxicity is reduced. And that's a good thing, right? We don't want something to be toxic. But be careful, as I had mentioned, patients with heart conditions, high blood pressure, allergies, anything like that, you want to be careful with epinephrine, and a plain anesthetic is going to be better. Now, needle types and injection techniques. So there's infiltration and blocks. So a block is meant to target larger nerve branches and typically used in the mandible. So you will block half the mouth where half the mouth is going to be numb. We would never do any restorative work on both sides of the bottom teeth because then their entire bottom mouth is going to be numb and that's not a good feeling. It's hard to speak, eat, the whole work. So we would typically separate that into two different appointments so they're not that numb. But infiltration is where you're just basically injecting into that single tooth by the apex, so by the root area. And this is typically done though for the maxilla. It can be done for the mandible too, but with the way the nerves are, it's better to just do a block in the mandible to make sure they're absolutely frozen. But there are differences between needles. There's short ones and long ones. The long ones are going to be used for the nerve blocks. Why is that? Because when we block the nerve, we have to inject the needle way back here, so behind the last tooth. The retromolar pad area, for those of you who are dental professionals watching this. So we need to inject there. So the needle has to be longer, right? Because we need to angle our, hand a certain way to inject it there. But the short ones are used for infiltration because we're just going right at the site. Like, say, we're doing a filling on this tooth here on the inside, we would just kind of inject there, not all the way back here if we were doing a block. So there's differences between the long needles and the short needles. They can vary in color. Like, people often ask me, well, the cap of a short needle, what color is that? Typically yellow, but it could be red, it could be blue. A longer needle is typically blue, but It could be different. Just look at the length, which one's shorter and which one's longer. And then you'll know which one to use. Now, what if somebody is having a reaction to their local anesthetic? So, these could happen where very mild symptoms, such as not feeling very good, they're getting dizzy, a metallic taste, or moderate to severe would obviously be a drop in blood pressure, or they're having trouble breathing, they're having a seizure. This is obviously not good. And in any of these cases, though, you would automatically stop because they're having a reaction. You wouldn't just keep going. You would administer oxygen right away because you need them to have that influx of oxygen, monitor the vital signs, and then just kind of see what you need to do from there. You would do whatever you had to do depending on their symptoms, right? If they're just simply dizzy, you wouldn't, start CPR because they haven't passed out and there's no issues there, right? You would just handle the symptoms that they have. Topical anesthetics, step by step here. So make sure to dry the area before you apply the topical. If you don't dry the area first, then the saliva can kind of take it away and then it doesn't work properly because some of it might all the way could be over here when you tried to place it here, but their saliva kind of took it away. And you just need a very small amount on a Q-tip, a cotton tip. Allow it to sit for 1 minute. So they say it's better to let it sit for 1 minute before you inject that needle with the local. And don't use too much because you don't need too much. You just need a little bit because it's going right to the site. Now, safe dosage calculation. So, how would you do the dosage for this? So, this is checking to make sure your patient's weight, you're giving them the appropriate amount of anesthetic, not too much, but also not too little, where it's not going to do anything. So, here are just some examples for you guys here. Feel free to check that out in the study guide. Again, if you're interested in what I'm going through here today, I do have it all in a free study guide. You just have to click the link in the description and it will be emailed to you, or sometimes you will log in and then see it there. Okay, so talk about different concentrations. Like you guys can kind of go over that on your own because it's pretty self explanatory. But I tell you how to calculate the dose, which is nice. Now, just some important reminders here. So it's good to round down to keep things safe. You would adjust the dose, however, if somebody's medically compromised, elderly, or even children. When you're combining different anesthetics, you want to use different lower dosages and always document in the chart. It can be helpful to create a cheat sheet, especially if you're, studying for exams. It can be helpful to create a cheat sheet because there's a lot you have to know, right? And then reversal agents. So what are they? So what if there's an overdose, they're having a reaction and you're like, "Whoa, like this isn't good here." So what do you do? As you guys can see here, there's different types of reversal agents. I'd say the most common one that we've all probably heard of is the naloxone, Narcan. This is actually going to reverse the overdose. So if they've overdosed, it reverses it so they wake up, they feel better, but they still need to be hospitalized after that to make sure everything's okay. And these are obviously used in emergencies, not just if somebody feels dizzy and they don't really feel good, but if things are getting worse, then this is when you would use a reversal agent. Um, and then, of course, questions to ask them before local anesthetic or even topical is given. You need to know their medical history. So, I go through things specifically here for you, and we talk about this more in the Board Exam Prep Academy. So, if you're not a Dental L member, you definitely want to be because we have a whole module just on dental anesthetics. But just to give you guys an idea here, if there's a heart condition, why is this important? Because epinephrine is in a lot of anesthetics, and that can actually speed up the heart rate and increase the blood pressure. So, if somebody already has a heart issue, such as angina, arrhythmias, a recent heart attack, or in my opinion, any heart attack, even if it's been 2 years or 10 years, you need to be careful here. Uncontrolled hypertension, so high or low blood pressure, you need to be careful what type of anesthetic you give them. What if there's an allergy? So there are ester type allergies, so that would be more specific to topical. But what about a sulfite sensitivity. So that's important to note as well. And you need to document their reaction. So if they're telling you they're allergic to something, you don't just say, okay. You say, what happened when you had this allergy? They might say, oh, nothing really. I just didn't feel well that night. So we suspect it was from the anesthetic. Or they might say, oh, you know what? My heart stopped. Like these are very extremes, but different things that you have to make note of. So always make note if they tell you there's an allergy or if an allergy happens in the dental office. You need to make note of that in the patient's chart. Are they taking blood thinners or anticoagulant medication? So this is important because they might have to stop their blood thinners or have less, depending on what type of anesthetic you're going to give them. What about, do they have any liver or kidney problems? So obviously, if the liver or kidneys aren't functioning properly, they can't eliminate any toxins. They can't eliminate, if there's too much anesthetic in there, it might get absorbed too much and then we have problems. So see how we have to ask all of these questions. So I kind of go through this in great detail. So as I said before, be sure to download the guide if you would like it. But now let's just jump into, last but not least, the essential emergency drugs. So you need oxygen. You cannot give too much oxygen to somebody. Like, I'm sure you could, but with any medical emergency, you want to give them oxygen right away because this will just help with almost anything. You might have to do more, of course, but oxygen is the way to go for most medical emergency situations. There's epinephrine, which is an auto injector. So, this is a severe allergic reaction, or they're having a heart attack. You need to inject epinephrine, and that will kind of help to bring them back. Like, say they have an anaphylactic shock, they need this epinephrine to bring them back and get them out of that anaphylactic shock. Diphenhydramine. So this is an antihistamine against an allergic reaction. So if somebody's developing a rash or they're itchy, you're not going to give them the auto injectable of the epinephrine here. No, that's for more extreme cases like an anaphylactic shock. But if they just have a rash, like they're getting itchy, and you're like, whoa, like your face is turning red. What's going on? You would give them diphenhydramine, which is an antihistamine, and that should help to counteract that reaction. There's nitroglycerin. So if they're having chest pain, not necessarily a heart attack, but you're like, something's going on here, then there's nitroglycerin. What about an inhaler? So if they're having an asthma attack or they're having trouble breathing, not necessarily an anaphylactic shock where they can't breathe, but they're just kind of having trouble. They're taking extra breaths, and you're like, okay, you need your inhaler. That is something that could be given. Glucose oral gel tablets, juice, sodas even, if they feel like they're low in blood sugar, you would typically give them a juice box, or perhaps they have like glucose tablets. You want to give them sugar. Like, you basically want to give them sugar to bring up their blood pressure quickly. This can happen often if you see a diabetic client and they forgot to eat lunch, or they were rushing to their appointment and didn't eat yet. There's aspirin. So, see, you guys, there's so many here. There's aspirin, ammonia, inhalants, lots of different ones for you to go over, but then that's it. So, this was a quick study guide to just kind of think about topical and local, know the different types, know the different kinds. We kept it very simple today, but please comment. Let me know if you have any questions. I'm always happy to help, and thank you for watching.